All right, everybody. So welcome to part one of our breathing clinic with Lakeside Oral and Facial Surgery and Hobson Institute. So nice to have everybody. Obviously, not being in person, I'm sure we're going to do the best we can here with technology and with demonstrating everything. But I think Dr. Hobson's been doing this throughout the past couple months. So I'm assuming you have the hang of it with demonstrating by now. So as we move into the virtual event, I think we're going to be talking about different supplies, like the ones that I emailed you guys over, and different techniques and methods that she's learned throughout her experience. She is a physical therapist and has been for, I believe, over 20 years, and specializing in head and neck with TMJ focus, craniofacial disorders, and obviously all of her breathing therapies and methods that she's learned and developed training programs for to be an educator, with her two clinics in physical therapy and breathing in the Chicagoland. She's very well known. I'm sure some of you have heard of her before, or have referred patients to her. So interestingly enough, she just got back from Chile to learn from her mentor. Dr. Hobson, what's the name of your mentor again?
Dr. Mariano Roccabato. He's just known in the dental world and the PT world.
Yeah.
So some dentists might know about him, but he's a big, important person to me. And the head and neck PTs, that's like one of our mentors and people we look up to. So
yeah, you work with your university to teach his methods also.
University of St. Augustine, that's right. So I certify craniofacial certification for any head and neck TMJ therapist that wants to get craniofacial certification. So that's what I teach too.
Yeah, so we're going to be learning a lot more about her techniques and all the methods that you have found useful with patients and even providers like you all. So I think that we'll pretty much learn a full span here between things that we can apply for ourselves and things that we can apply with our patients. So unless you have anything to add about yourself, I'm sure you do, Dr. Hobson.
No, that's okay.
You guys can continue, and I can leave you all, so I'm not the center of attention.
Okay.
But if anyone has any questions after the clinic or anything that you want me to send to you, I believe everyone should have the supplies list. But if you want me to send you anything else, or any of her links, I can always email those out to you. You all should have my email. So, all right, you guys enjoy.
Thank you, Christina. Thank you so much.
Thank you, everybody.
Appreciate it.
Bye.
Okay, great. Okay. Now it's Dr. Harvey. Hi. I don't know why this is happening. Let's see. Well, if I go to Spotlight for Everyone, there we go. I did it. Okay. Everyone see me. Okay, so welcome everybody. Today is the first of the 3 sessions. I've been doing these since 2013, and they're kind of like my passion. This is really the root of why I feel like a lot of people have head and neck TMJ, malocclusion, issues with headaches and TMJ and stuff like that. So this information, the first day is the longest, and unfortunately we're not going to cover everything the first day. It'll spill into next week, which is fine. But just know that the material that you're going to get, I'm going to send Christine a list of all the exercises, kind of notes of what you've gone through. You can take notes too. This is going to get recorded, and we'll send you the link afterwards. So I am going to share my screen. Actually, first, before I do that, what I want to know, if you have gotten any of the supplies. The supplies are kind of important, and you're going to want to get them soon if you haven't gotten them. And if you haven't gotten them and you don't know where the links are, and so email Christina. She has all that information, and I will definitely help out if you need to. But there's certain things you need to do to improve your sleep, and that's what all those supplies were basically, to help you sleep better, help your nose work better. Okay, so a few of the things that I have in front of me are nasal dilators. Someone else is joining us. A lot of you might know, the Breathe Right strips. Those are those are the easiest. I think people really like Breathe Right strips because they're not something in the nose. There's these that are called the Nasal Aid. They have a new version which is white, but this kind of goes in and just spreads your nose wide. I tend to put um, a tiny little bit of tape on the top of it just so it doesn't fall out. You're going to see me do a lot of silly things today, but that kind of keeps it still. I'm using a little transport tape, but you can use any like micropore tape too. But what you're going to learn is the importance of opening up your nose. Your nose is one of the most underutilized organs of our body. So we're going to try to use it as best we can. There's cones. I know you all have probably used cones before. These go up, but it's to open up any part of the nostril that is deviated. If you can see my nose is a little, you can see that the septum was bent. A little background about me. I am a bicuspid extraction case. I know the majority are dentists that are viewing this. So I was tongue-tied. I was a mouth breather, had no idea until I was 37. I was a mouth breather. And crowded teeth, when I was 12, they pulled my bicuspids and straightened my teeth. And I ended up with a bent nose and resistance to breathing through my nose. So I ended up mouth breathing and developed that way. That's kind of me. And then found out that my dad was tongue tied, and he gave that little trait to all the children. So even my children were tongue tied. It was really my children that taught me about this whole tongue tie issue and the effects of mouth breathing. Both my kids needed tonsillectomies, adenoidectomies, because they were mouth breathing and had a low tongue posture because they were tongue tied and were just always congested. And it wasn't until I went to a sleep apnea conference and met a myofunctional therapist. And hopefully you all have heard of myofunctional therapists. They are therapists that it's almost like a PT to the mouth. And I am a PT to the mouth, but I had no idea the training that it took to change mouth breathing. And that's really what myofunctional therapists do. They work on swallowing, they work on breathing through the nose, they work on proper tongue resting posture. So that will be the focus of next week. But that's just a little bit about why I got into this field, and it's such an interesting field. So many people are snoring these days and have issues with headaches and neck pain and TMJ clicking and all that. And recently this book Breath came out, and I had the luxury of interviewing James Nestor, who's just an amazing journalist. Um, it's basically opened the eyes to the public around this breathing problem that we've had for years, and nothing's new about what is in there. There's some old information that keeps resurfacing, but people kind of keep overlooking it. And this is our health. This is what's going to make us healthier. This is what they tie lung health to longevity. So we want to make sure that we live as long as we can, as healthy as we can. And that's what you're going to hopefully learn, some tricks and tips of how to do that. All right, so I'm going to start my presentation. All right, so this is session 1. Constantine Buteyko, Dr. Buteyko, the first session is mainly about Buteyko. And Buteyko, if you know anything about Buteyko, it's all about breathing through the nose and breathing less air, less volume, and using your diaphragm. Very simple. All that you're going to learn is not difficult, though we get in really bad habits, and that's why it's difficult to change when you don't know you're in a bad habit. So here's a little history about him. He was a medical doctor. He monitored the breathing volume of patients as a practical assignment at his hospital, and he discovered the sicker the patients were, the heavier they were breathing. So in 1952, he was able to reduce his own high blood pressure by practicing simple exercises to reduce their breathing. And I do that with pulse oximeters. I test my patients before and after slow breathing techniques, and it reduces up to 10 points. So it works. It really does work. So Hobson, these are what we're going to cover. And basically the objectives are, I have an online program that I'll talk to you about at the end. This covers all of the online. We're not going to get to probably the last 3. We'll do that next week. And don't worry, we'll make sure that we get all of it. It's just this week, it's too much to do it all. So let me go back actually. So we're going to learn how to assess our own breathing. We're going to learn how to unplug our nose. We're going to learn how to clean our nose and how to keep it open for breathing. We're going to learn many different ways to reduce our breath rate. You're going to end up picking one that you really like. And then the supplies, we're going to talk about some of the supplies as it comes in the presentation. We're going to learn how to tape our lips. Hopefully some of you are already doing this. I know it sounds crazy, but it's something that just ensures nasal breathing. That's for nighttime. And for mouth breathers that breathe a little bit during the day through the mouth, I tell people that 30 minutes out of their workday to use tape. Training your breathing while walking with mouth closed. And the breathing exercises for stress, anxiety. I think actually those 4 at the end we won't be doing. Be doing next week. Okay. So what is our normal breathing volume? Oh, we got one more person coming in. There you go. What is our normal breathing volume? For 1 minute of air, it's normally 4 to 6 liters of air. That's considered normal. Okay, so what is the abnormal breathing volume of asthmatics and sleep apneics? So it's the kind of the two majority of people that I see for breathing problems is asthmatics and sleep apneics and mouth breathers. But you can see that the asthmatics are breathing 13 liters of air per minute, 14, 15, so much more than the 4 to 6. The sleep apneics are breathing 15 liters of air per minute. So there is a big increase in volume that people are completely unaware of. So we want to make sure that if you have those 2 diagnoses and mouth breathing, I should throw that in there, we need to reduce your volume. The traits of dysfunctional breathing are mouth breathing, chest and fast breathing, breathing that you can hear, sniffing and sighing a lot, clearing your throat. You know, those people that are always clearing their throat. When talking, taking big breaths between sentences. And notice whenever I talk, and I'll stop share for a second, notice if you do this because, and I'm not perfect. Listen, I am a breathing patient. I had issues with all of this for many years. So I'm much better now, but just know that you revert to bad habits when you get excited sometimes. So when I talk, I try to stop and breathe through my nose in each pause so that I just don't blow all my air out and suck the air in through my mouth, blow it all out. That's all mouth breathing. I don't want to do that. So let me go back to this. So yawning, I used to yawn all the time. Yawning is really bad for you. I know it feels good sometimes to do, but it is not, it conditions you to big breathing all day. Lots of visible movement in the chest. A lot of my older patients have their chest moving up and down when they breathe. So it's like chest breathing and utilizing the accessory neck muscles. So those muscles that really tighten up your neck and bring your head forward, the scalenes, the sternocleidomastoid, those muscles are secondary muscles. They shouldn't be the primary muscles. So those tend to be what people end up utilizing, and then they forget about the diaphragm, which is really the biggest muscle for breathing. So traits of good breathing, you've got number 1, breathe through the nose. Number 2, breathe slow. 3, breathe low. What does that mean? Low is using your diaphragm. So getting the air in and getting it down low. The lower parts of the lungs has the most gas exchange. It's more economical and more efficient. So here we're going to talk about the gas exchange that takes place in the alveoli. How to breathe to improve this alveolar ventilation. So here you have three people, three examples. You got someone that's breathing 20 breaths per minute, someone that's breathing 12 breaths per minute, and someone that's breathing 6 breaths per minute. And we're going to analyze what that does to your body and how well you're able to oxygenate. So the first individual is breathing 20 breaths per minute into their body because the respiratory rate is quick. This is 1 minute. Basically, the tidal volume is 300 mils, which is the size of each breath. The MV is the minute volume, which is the amount of air that you bring into your body for 1 minute, which is about 6 liters. Even when you're taking in 6 liters of air into your nose, it doesn't mean that the entire 6 liters is getting down into the lungs. There's a certain amount of air with every breath that you take that will stay in your nasal cavity, in your throat, in your trachea, in the bronchi, in the bronchioles. Of that, if you take 20 breaths, half of it stays in that dead space. Half of it will enter the small air sacs in the lungs. So very inefficient. Fast and shallow breathing is very inefficient. So this individual that is taking 20 breaths per minute, 20 very inefficient, fast and shallow breaths, they're actually only bringing in 50% of that volume to the small air sacs. So it's not a good way to breathe. And believe me, many of us are doing that. Second example is 12 breaths per minute. And let's look at that. This increases the tidal volume proportionally to 500 mils. We are still taking in the 6 liters of air per minute, but because of the reduction of the respiratory rate, this increases the alveolar ventilation from 3 to 4.2 liters, which is significant. If we go one step further, if we reduce the respiratory rate to 6 breaths per minute and allow the size of the breath to increase proportionally to 1,000 mils, if you're trying to slow down your breath, just try not to make sure you're over breathing when you do this. Like you don't want to take huge breaths, 6 breaths per minute. It's still a nice gentle inhale, a nice slow exhale. Don't let the tidal volume increase disproportionately. But now you can see that there's a 5.1 liter of air getting down to the small air sacs, which is significant. This will increase your oxygen uptake in your blood. In order to prevent blood oxygen desaturation, it's important not to breathe fast and shallow. Okay, so the importance of nasal breathing for sleep, the risks of mouth breathing is basically what we're going to talk about. Mouth breathing increases the risk of snoring if you do. It increases the risk of sleep apnea. It's already been documented in the medical literature. It applies to childhood, teenagers and adults. It doesn't matter the age. There's even little infants with sleep apnea. It's a sad thing. Their architecture is creating that problem with their breathing and their genes. We don't have the statistics of how many children mouth breathe, but the studies suggest 25 to 50%. And adults that are over the age of 40 are 6 times more likely to spend 60% of their time with their mouth open. What happens when your mouth is open? Your mouth dries out. That dry throat, it dries out your throat. As moisture is driven outside of the airway, it leads to inflammation. As the airway gets inflamed, it gets narrower. As the airway gets more narrower, it creates a greater resistance to breathing during sleep. Now, this is going to explain why people snore, what happens, what are the steps that occur in their development as an adult, child to an adult, of why people end up snoring. So hypopnea, apnea, obstructive sleep apnea, the resistance to breathing during sleep increases the partial collapse of the airway, where the throat can collapse partially to cause a reduction to the flow of breathing, which is hypopnea. Hypopnea lasts for 10 seconds or more and is sufficient to cause a drop in your blood O2 saturation by 3 to 4%. And apnea is a total collapse of the airway. Obstructive sleep apnea is a total complete collapse of the airway. To stop of breathing for at least 10 seconds. So sleep disordered breathing, the negative issues, and I think I have URAS, upper airway resistance syndrome, because I'm so narrowed in my nose. But you've got snoring, hypopnea, URAS, obstructive sleep apnea. How does this all affect sleep? If you're constantly getting aroused and not getting into deep sleep, you're likely not to get refreshed when you wake up. Open mouth breathing increases the risk of obstructive sleep apnea. So the tongue is something that I think you as dentists, you're in the mouths, just like I mean, I'm in mouths all day and you are too. So I hope you all learn more about the airway issues that are created from a low tongue posture. And it could be a tongue tie, it could be allergies, it could be, the issue with a narrowed nose tends to come from a low tongue posture, but it could be caused by allergies or caused by a low tongue posture because of a tongue tie issue. So if your mouth is open, the tongue rests not on the roof of the mouth. It's going to rest down. The airway can collapse at the soft palate and fall into the throat. These are 4 areas that can happen. So right here, the soft palate can fall into the throat. The actual tongue, especially if you're laying on your back, I do not recommend laying on your back. If you are snoring, lay on your side because the tongue tends to fall backwards here. The epiglottis can also fall into the airway and the throat can collapse itself into the airway. So mouth breathing, good versus bad size of airway. Mouth breathing, it causes the mouth to dry out. The architecture of the upper airway gets narrow. That's what happens through growth and development. The jaw ends up falling back into a class 2 position. If you have good nose breathing during growth and development and a good forward growing, maxilla and jaw, you'll have adequate airway space. And a good airway is the size of a thumb. And a poor airway is the size of a pencil. That's not a good airway size. So the narrower the upper airway, the greater resistance to breathing and the greater risk of collapse of the airway. Okay, so mouth breathing affects, it causes more fast and shallow breathing. That's what happens. And some people think, oh, I'm not a mouth breather. A lot of people, I'm going to stop share for a second. A lot of people aren't aware of what mouth breathing isn't like. It's not like, it's like you could have just a little opening of your mouth and you're going to be mouth breathing. People aren't aware that they stop using their nose. So mouth breathing is something that you might be doing, maybe not, but the majority of people tend to mouth breathe because of food allergies, stress, a lot of reasons, but it happens more often than people know. Okay, so what happens? There's a reduction in lung volume. You end up breathing just up in your chest. That's what happens, and you don't get the breath down to the lower lobes. The throat collapses more easily. And if you're overweight, if you're obese, you put on some weight, the tongue actually gets fat. It creates less space around the throat. There are fat pads in the throat that occupy space. But what impacts more about fat on the belly fat will cause us not to use our diaphragms. This is not good. Our diaphragms are the main muscles for breathing. That's a main huge muscle. So your diaphragm, when you breathe in, I'll stop for a second. When you breathe in, your diaphragm lowers. Your pelvic diaphragm lowers too, but you breathe in, it lowers. As you exhale, it recoils up. So what I want you to know is people don't use that. And then they strain their backs easily. They don't have a lot of good core stability because the diaphragm helps with core stability too. So if you have a tummy, you got to know that it's affecting your breathing. There you go. All right. To keep our airways open, what do we need to do to keep our airways open? For sleep, we want to maintain an open airway. That the muscles in the throat are all designed to keep the airway open. We need a nose breathe the whole time. And that's why I would love for you all to try taping, and we're going to go over that in just a moment. Light breathing. Light means reduced breathing techniques. We're gonna teach you how to do that. Slow breathing. So we're gonna go from breathing fast and through the mouth up here to learning how to use our nose and breathing slow and low using our diaphragm. Okay, so last thing about snoring here. So try this, and if you wanna, I think everybody is on mute. So try this. If you ask your patients to make a snoring sound, they'll open their mouth and they'll go like this, right? We take care of that with closing our mouths at night with tape. That ends up taking away the mouth snoring. The nose snoring. Here is where there is a turbulence inside the nasal cavity. There's too much flow. So 2 factors involved in snoring is flow and airway size. 2 different things. Now, try to make a sound of a snore through your nose. Okay, so I want you to try that. Close your mouth and you all have heard that before, that sound of inhaling and there's something flapping in the nose, right? So what is that? So what we know is that it's more increased flow and you're creating more turbulence in the airway. So practice tongue posture and slow breathing. Place your tongue in the roof of your mouth. Right now, try to put your tongue up. I always tell people, start with the N, say N. That's the first third. And then flatten your tongue up there. And I'll stop for a second. If you say sing, the end of sing gets the back of your tongue behind, like in the back of your mouth, up against the back molars, the back, probably your second molars. And I'm narrowed, right? So when I try to do that, I feel my molars. So I do sing, and then I put my tongue in the end. Sing and end together. Sing and. And you don't suck on your tongue. It's a gentle thing, nice and relaxed tongue, but up. Okay, so that's the first thing. The tongue posture is really important. We're gonna do more of that next week. Take a slow, gentle breath in and a slow, gentle breath out. Now try to snore when you do that. Slow, gentle breath in and a slow, gentle breath out. So you cannot snore when you do that. There's not enough turbulence. There's not enough flow. So think of snoring not only as the airway size of your throat. I know you all are probably taking some cone beams and measuring airway volume. We do that in our office. We have a dentist that has an CBCT in just downstairs that we are able to use frequently, which is great. We need to look at it more as an engineer. If you're an engineer and you're looking at a pipe or a tube, you're looking at the diameter and you're looking at the flow. One is relative to the other. Okay, how to reduce snoring? When we get the mouth closed, the mouth snoring stops. To reduce nasal snoring, we need to bring down the flow of breathing. We're going to practice slow breathing exercises. We'll in turn develop a habit of slow breathing. It'll reduce turbulence or resistance to the airway. You practice reduced breathing techniques. We'll go over that. What happened? Sorry. You slow down your speed of your breathing to create a point of air hunger. So air hunger is you're going to feel, I want you to start reducing your breathing, and we'll go over the exercise soon that will make you feel like you need a little more air. If you're having issues with breathing, if you're a snorer, if you have sleep apnea, you're going to have a problem with this, but little by little, you'll get better at it. So that is coming into the nose at the top of the breath. You want to get to a point of complete relaxation so that you have a relaxed, gentle breath out. We're also going to go over cadence breathing. This is probably the easiest one to do. And actually, I'll stop right now. I like this one I'm going to stop share. Everybody try this. Hopefully you want to try this. There's two ways to do it. I put my hand on my chest and my hand on my tummy. Okay. I'm gonna count for you, but obviously you're gonna count, you can count on your own at your own pace, but it's in for 4, out for 6. Okay. So hopefully it's not too slow. And if it's too slow, it means you're probably over breathing and you need to work on it. All right, so gently, tongue up, mouth closed. Gently breathe in through the nose. 2, 3, 4. Out. 3, 4, 5, 6. Gently breathe in through the nose. 2, 3, 4. Out. 3, 4, 5, 6. Now, what is my hand doing? My hand up here. I want to feel that nothing is moving here. But I don't want to feel like when I'm breathing through my mouth, oops, I go like this. You see all that movement? That's too much movement. That these muscles are going to pull my head forward. I'm going to end up with neck pain. It's not good. So you want to put your hand here to feel like nothing's happening here. Get yourself stacked up too, and don't cross your legs, put your feet flat. Hand on your tummy to feel that your muscle in your diaphragm is working. And when you breathe in, this should expand out. And it should be 3-dimensional here, not just forward. It should be kind of like your rib cage and your lower third, sorry, your lower part of your rib cage is expanding. So again, hand on your chest, hand on your tummy. Gently breathe in, 2, 3, 4, out, 3, 4, 5, 6. Gently breathe in, 2, 3, 4, out, 3, 4, 5, 6. Gently breathe in, 2, 3, 4, out, 3, 4, 5, 6. I'm going to adjust. This is another little adjustment that you can make if you don't feel like the lower part is moving. I'm going to move my screen down a little bit. Lower 2 ribs. I want you to feel the lower 2 ribs of your rib cage right here. Put your hands, your two, like just kind of use your thumbs around, just above your waist. Here's my waist. I'm going to go up and just feel where your ribs are. Squeeze them, squeeze them. And now when I breathe in, the same 4 to 6, you're going to squeeze as you inhale. And then when you exhale, just let go. Squeeze as you inhale, exhale, just let go. So ready? Gently breathe into your hands. Breathe in, 2, 3, 4, out, 3, 4, 5, 6. Squeeze. Gently breathe in. So when you breathe in, you want to have something against, the diaphragm to get the diaphragm to push out against it. Okay, that's why you're squeezing. Ready? This is called cadence breathing. Gently breathe in, 2, 3, 4, out, 3, 4, 5, 6. Squeeze again. Gently breathe in, 2, 3, 4, out, 3, 4, 5, 6. Squeeze again. Gently breathe in, 2, 3, 4, out, 3, 4, 5, 6. Gently breathe in, 2, 3, 4, out, 3, 4, 5, 6. I know it seems simple, and it is, but I think a lot of the problem is that we're so busy, right? And we keep putting more on our plate, and we don't have enough time to just take our time in life. And our breathing is compensating for that crazy schedule. And maybe I'm over speaking for everybody, but I'm really looking at my life and trying to cut out whatever I can to create some peace and some, healthy habits. All right, I'm going to keep going. So that was cadence breathing. That's not buteyko. That's cadence. You just breathe in for 4, out for 6, and try that for 5 minutes. See how hard it is for you. Okay, we're going to go back here. CO2. CO2 is important. You should feel an air hunger when you do these slow breathing techniques. It's going to want to make you feel like you need a bigger breath. As you do this, as you slow down your breathing, your CO2 increases. Reducing your breathing volume, it actually increases the CO2 in your blood. because you're not blowing it off so much. Your CO2 is what you exhale. Feeling of air hunger is caused by an increase in chemosensitivity to CO2. So breathing becomes slow on a permanent basis when you are able to handle this decrease in breath volume. Okay, so how you breathe during the day actually affects how you breathe at night. So a lot of people are like, well, how am I going to control what I breathe at night? Well, if you slow down your breathing during the day, it actually changes how you sleep at night. And I always tell people the last 12 minutes of sleep, or sorry, last 12 minutes of your day while you're in bed, if you could try one of the reduced breathing exercises for 12 minutes, it's almost like a meditation. It will get you to it'll reset your respiratory center in your brain to breathe that slow all day. And remember, sleep apnea and snoring, you probably have sleep apnea or you're headed toward it. You're breathing too much volume, that turbulence. You need to learn how to reduce it. You got to do it during the day to be able to do it at night without thinking, obviously. Okay, so another aspect is fast breathing. Are you breathing fast or slow? Fast increases the turbulence in your air. Light and slow and deep does not. Deep breathing allows that lateral expansion of your rib cage. Remember, if you're breathing through your chest, it's all up here. You're not getting rib cage expansion. The abdominal diaphragmatically causes a stiffening of the throat, and it's less likely to collapse. So that way of breathing will help stiffen and create a little more stability in your throat. Research shows that changing your breathing during wakefulness and rest, it will positively affect your sleep. Nitric oxide is a whole other subject. We're only going to touch it a little bit here, but it's a gas that's produced in the paranasal sinuses, the nasal cavity. The role that it places in sleep is not fully understood yet, but signaling molecules between the nose, the throat, and the lower regions of the lungs. It creates that signaling. As you breathe slowly through your nose, you harness nasal nitric oxide. Some communication from nitric oxide from the nose to the throat to help the functioning of the upper airway dilator muscles of the throat. That's what they think happens with nitric oxide. These muscles during the day do their job, but sometimes not during the night. Become lazy and they don't respond to maintaining the airway open in some people. So it's also a natural nasal dilator, an antiviral, and an antibacterial, has its components. So especially during COVID, whenever I'm in any situation where I'm near people, I even stop breathing when I'm trying to pass people, because I don't, regardless of the mask, I just don't want to share that air. Okay, so this is actually a study that supports what we just learned about the 6 breaths per minute. We're looking at the work of Dr. Bernardi, who is an Italian cardiologist. This is not his paper, but it analyzes his work. It looks at the effect of slow breathing at high altitude. These individuals that did the study, that were in the study, climbed Mount Kilimanjaro, which is 4,559 meters high. When they were doing spontaneous breathing, when they were doing normal breathing, their blood saturation at that level was 80%, which is considered severe hypoxia. When these individuals reduced their breathing to 6 breaths per minute, it increased their SpO2 from 80% to 89%, which is considered mild hypoxia. So you can see how just changing the amount of breaths per minute really can change the oxygenation of their bodies. So I'm going to keep going here. What causes dysfunctional breathing is stress, lack of exercise. I hope everybody's doing some kind of exercise. I know it's hard, especially now with the snow out there and the gyms being a little limited. But there's a lot of Zoom classes on Pilates and yoga that you can do, and it's necessary. We need, and I have my Fitbit on and I'm trying to get 10,000 steps every day. Sometimes I'm climbing up and down my stairs just to do it, but it's important to keep that up. Unhealthy eating habits. If you're overeating, it changes your breathing, believe it or not. Taking multiple breaths per day, excessive talking. And I'm a talker, and that's probably one of the reasons why I'm a breathing patient. But if you're someone that talks a lot, you got to start listening more. You got to really change the way you're using your body. Listen more. Also, high temperatures in the house, not good. Makes you overbreathe. Obviously, genetic predisposition. We have people that have, a family chain of breathing problems. That's also going to be a factor. And asthma, of course, if you have asthma. But this is the shape of things to come. We've been, we're no longer hunters or gatherers. We're not running around trying to defend ourselves from lions or animals. We've got to the point where everything's really easy to eat. Everything's really easy to get, and you're walking and you're eating at lunch, working on the computer. You're not really stopping. And this, I will tell you, I studied in Holland for 3 years. My physical therapy studies, not my doctorate, but my physical therapy studies were in Holland. And they cherish their coffee breaks and their lunch breaks. You're not really allowed to bring any work, and they get upset if you don't go. At that time, people were smoking in the hospital where I was. That was, a long time ago, but things have changed for the better. But Amsterdam is really just a great place. And just Europe in general, it's just slower. People, when it's a nice day after many days of rain, people would stop and sit at the cafes and take off work. It's just a different way of life. So breathing stimulus to what's the primary breathing stimulus to breathe is actually carbon dioxide, oxygen, and pH levels. Those three things. Your body's always trying to make sure that those three things are in balance. So CO2, when it increases, when you hear that person that has sleep apnea have a big pause and then a big breath, that's when the brain stimulates breathing to get rid of that excess gas. So the primary stimulus to breathe is to eliminate carbon dioxide from the body. One of the things I really think is important is that you want to make sure, if you've ever had a car accident or even an emotional crisis in your life, maybe your wife died, your husband died, your boyfriend or somebody, and it really traumatized you. In that period of time, your breathing probably changed. And you know what? After 24 hours of breathing that higher rate, it changes your breathing. So breathing more than what your body requires over 24 hours conditions your body to an increased breathing volume. So CO2, it's not just a waste gas. We've got, this pH and CO2 connection. We want the pH to stay pretty normal. If you go too basic or too acidic, cells start to die. That's really important to understand. Our bodies are always trying to monitor that without us knowing. Then overbreathing, this is called the Bohr effect curve. And basically you inhale oxygen, it binds to hemoglobin. If the CO2 levels are too low in the body, because you're a mouth breather or an overbreather, what ends up happening is that bond to CO2 and hemoglobin, that oxygen bond to hemoglobin gets so strong that it doesn't allow it to disassociate. So you end up having a reduction of oxygen of your tissues and your organs. And it's really one of the things that people don't understand is, well, I need a bigger breath. I feel out of breath. When people are hyperventilating, they actually need to breathe less. It happens in my office. Sometimes we do dry needling, and a couple of times, and I'll tell you that next week, I had a big problem, but slow breathing got us out of it. CO2 is made in the muscles. You've got to know that. And it's also a byproduct of metabolism. So the more you exercise, the less breathing problems you'll probably have. But if you have cold hands and feet, you'll end up having a reduction in the volume of arterial blood vessels up to 50% when the volume of air is greater than what you need. That's why people end up getting cold hands and feet, is because it's harder to get the blood down to those extremities that far away from the heart. This is a typical mouth breather, very long face. Typical boy that's a mouth breather. This looks like a normal mouth. Nobody would think is there anything wrong with this look. You know, this is a typical kid, and especially kids now, they're playing on iPads and iPhones and looking down, and their tongue is down, their head's forward, their mouth is open. It's not good. So here are the few things we're going to learn today. Control pause is the first thing. How to unblock your nose. Our goal is to switch to nasal breathing on a permanent basis. How to reduce the volume back to normal, and changing our lifestyle. So let's try this exercise. And if you have a phone, it's the best thing to have to measure this. So I always tell people to get their phone out, get their stopwatch on. And what you're going to do is close your mouth, tongue up, try to sit up straight. You're going to breathe in and out. You're going to breathe in and out, and we'll do it 3 times. And what I want you to do, we always exhale and then plug. Why? Because the volume of air in your body is always consistent. If you inhale and plug, we don't know how much air you've brought in, and it might be bigger than the last time. So if you exhale everything gently out and then plug, it's always consistent. So we're going to breathe in and out 3 times. After you exhale, you're going to plug your nose, and then we're going to count the number of seconds until you feel a distinct desire to breathe in. All right. So at the first distinct desire to breathe in, you might feel a neck jerk, a tummy jerk. Those are signs that that's your body saying, okay, it's time to breathe. Your inhalation at the end of the breath should be calm. Then you release your nose. So just know that breathing, when you do this exercise, we're about to take another measurement right after this, is how long you can hold your breath. So it's not the same. This one is, let your body tell you when you need to breathe. Your neck's going to go, ooh, your tummy's going to go, ooh, then you unplug. Okay, so let's just try it. Gently breathe in through your nose and gently breathe out through your nose. We'll do it 3 times. Get your timer ready. Gently breathe in through your nose and gently breathe out through your nose. Last one. Gently breathe in through your nose. Let everything gently out. Get ready to plug your nose and plug. So you're just holding. When your tummy or your neck say, oh, and there's like a little jerk there, unplug and keep a note of that number. And remember, it's not the same as how long you can possibly hold it. Let your body tell you. Okay? So write that number down and we'll see what that number means, okay? I do this every morning, especially when I do my breathing clinic. So my breathing clinics get me back to doing all the exercises in a structured way, but testing yourself in the morning will tell you how well you slept that night. Okay, so a CP of less than 20, control pause is what we're calling CP. Less than 20 means that you have main symptoms are present, either a blocked nose, you've got snoring going on, you've got insomnia, fatigue, sleep apnea, coughing, wheezing, breathlessness, or exercise-induced asthma. A CP of 20 to 40 means that your main symptoms are gone, but symptoms might be exposed to a trigger. For me, my triggers are red wine and chocolate. That plugs me and it's not good. Do I always avoid it? No, because it's a nice taste when I want it sometimes, but it will plug me. I will have to deal with my nose being plugged. So those are triggers. Just understand that if you're less than 20, these exercises you're going to learn are important. Okay, so a low CP, someone that has under 20, their breathing is erratic. It's all over the place. It's never the same. Someone with a high CP, and the high CP, you want to be up to like 40. And believe me, I'm at 32 and I've been doing this since 2013. I started at 16 though. So just know that it's like a muscle. You really need to practice to get it better. You can't just do it once in a while. This is really, hopefully, a way of just transforming the way you breathe. A high CP is someone that's really calm and gentle and silent, relaxed breathing. Okay, so next exercise is decongesting the nose. This is the one I was telling you about that you need to breathe and exhale, plug, and make sure you're holding it as long as you can. So this is the only problem with this one is that it's a little dangerous if you have heart problems. So if you have a history of a heart attack, don't do this. If you have a history of stroke, high blood pressure, don't do this. Reduced breathing is super safe, but holding your breath this long, 5 times in a row, is not safe for those people. Okay, so I want you to know that just don't do it. Or if you're pregnant, is not good either. So here we go. You're going to breathe in and out. You're going to pinch your nose. You're going to hold it as long as you can. And what we do is sway our heads when we want to distract ourselves. And then when you can't hold it any longer, you release your nose and you resume breathing. Very simple. And then you basically calm your breath as soon as possible. I normally give people 3 breaths of being big. And then you wait 30 to 60 seconds and you repeat it 6 times. So everybody, test your nose. Cover gently. I'm going to stop for a second. Stop share. Cover your nose just like this. Like place your finger right there. Breathe in and out of one side. And 0 is completely open. 10 is completely plugged. What is that? Make a note of what that side is and then try the other side. Right? So sometimes one side's more plugged than the other, and we definitely want both sides to be working. Okay, so that's one thing. I'm going to have you sit up straight again, and we're going to go a little over. If you all can't stay on, don't worry about it. I'm going to record this and we're going to send it to you. So but this is decongest the nose exercise. We'll just do it once, but know that when you test it and you're really plugged, even if you're sick, you can do this. You know, there's a lot of walking exercises. This one, you don't have to walk. I have had people in wheelchairs do this and it helps because you don't need to move, but it helps unplug the nose. Remember, CO2, when you don't exhale so often, it increases in your blood and it's a natural vasodilator. So to unplug your nose. So gently breathe in. And gently breathe out. And gently breathe in. And gently breathe out. Get your timers ready. Last one. And gently breathe in. Let everything gently out. Get ready to plug and plug your nose. Now, this one you're going to sway. Your tongue is up and you're going to sway. This distracts you. It's just a way of you. You know, I even close my eyes when I do it. I'm saying, can I hold it a little bit longer? This one you're going to hold as long as you possibly can. And you're going to time yourself. And if that number is the same as the first number you did with the control pause, that control pause is not accurate. So you want to just hold it. And when you need to breathe, don't mouth breathe. A lot of people will open their mouth. And note that if you just did that, what I recommend that you do is take your tape, and there was tape on that. Let's talk about tape real quick. There's tape on the supply list. This is transport tape. I ended up buying a box of transport tape, and I actually like it, but microport tape is fine too. It's hypoallergenic. I always tab it, pull it, the width of the mouth, and then put it in the back of the hand. Then cover your mouth. Okay, if some people are really scared of that, what I tell people to do is just do one, get used to it. And if you can, maybe do 2. So you can still breathe on either side, and it's not as scary. I've been doing this since 2013, and I used to yawn waking up all the time, and this changed my life. So if you want to try one thing that really might work, is use a breathe right. This is what I do every day. And if my nose gets too irritated here, and by the way, I do it after I've cleaned my face. So you want to dry out your face a little bit. Wash your face. Put the Breathe Right on. And when you put the Breathe Right on, if you've never done this, got to get it in the middle of the bridge. And I mess with this for like a good 30 seconds, maybe 40 seconds, because I don't want it to detach, and I just keep pushing, 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 pushing. And what does it do? Voila, it lifts the walls of my nose away from itself. So it creates a more patent airway. So that, to me, I wish I could walk around with this. And when I exercise, I wear one of these in my mask. And believe me, you want to exercise with your mouth shut. Remember, your body is always conditioning itself to big breathing if your mouth is open. So if you can do your whole entire workout with your mouth shut, you've already done your reduced breathing. You're reducing your volume just by doing that. And yes, does it mean you might have to slow down when you're running? If you're a runner, yes, slow down. Slow it down so that you can tolerate it. You don't want to get used to big breathing all day and then run and exercise with big breathing, mouth open. It's not going to get you healthy. It's so much healthier when you keep your mouth closed when you breathe. So, okay, for the sake of time, we're not going to do 5 of those, but that's what I would do if I was plugged. I'm always checking my right and left side to see if I'm plugged. Okay. Really quick, another thing I wanted to show you. This was one of the things that was on the supply list. This, and also, you know, I have a NeilMed bottle, and this is a Nasaline bottle. Okay, this I use once a day, or my NeilMed bottle. This thing you can travel with. I bring it with me to the office. I'll do it at least once a day, maybe more if I'm congested. What do? You take the top of this. The top of this, the applicator is why I want you to use this. Why? Because when you go in, it's a long applicator. It goes right to the nasal valve once you put it in. But you can take this off. It's just the applicator that I want. You get, get a trash can, spill what's in it out. I've already taken everything out. You take a third of this packet, a third of your NeilMed. This is actually a NeilMed sea salt packet. I'm going to put a third in here. If it's too salty, put some out and, put more water in it. It's not rocket science. I'm going to this is reverse osmosis water. Distilled water is probably very, a lot of my patients that don't have reverse osmosis, I just say, go buy a gallon of that distilled water. You pour into the bottle. Okay. And then I know this is taking some time, but believe me, if your nose isn't working, you have to get it to work. You have to get it to work. That's the only place you should be breathing. Where did I put this in? Okay, so then you put it back in, and then it should snap. If it doesn't snap, it'll spray all over you. So, and I'm going to show you what I do with this. This is not a normal way to use this. Okay, so you're going to inhale, you tilt your head back, you go all the way up to the nasal valve, you inhale and you swallow it. It's just a little bit of sea salt and a little bit of distilled water, reverse osmosis water, and it basically cleans the back of your nose. That part gets gnarly. Okay, so you want to make sure that the salt water cleans anyway, but you want to get it past that area. And I learned this from Dr. Lois Laney. I was one of the little guinea pigs in the front of the class, and it sprayed all over me, and I coughed because I was a huge mouth breather at the time. So this is not comfortable. I'm going to show you how to do this. Head back, and it's twice that I do it. You inhale, and it's a spray, and I swallowed. I'm going to do it again. Inhale. Other side. Tilt your head back. Inhale. One more time. Inhale. And it really wakes you up. My sleep apneics, I will tell them to use that a lot to get them to wake up because they're so tired all the time. But they also, oh shoot, I don't have it with me. The little neti stick, that little neti stick, or the Olbas stick, keep that in your pocket throughout the day. If you've got sleep apnea, that thing will wake you up, but it wakes up your nervous system. Your olfactory nerve gets open and it gets stimulated. Then you blow anything that you have out, and that's it. So I will check my nose. I will clean my nose. I will do the long 5 breath in, breath out, hold, and plug. And then I'll retest afterwards to see if maybe I had a 4 out of 10 goes down to a 2 or a 1. Okay. All right. Last exercise. That's the decongest the nose. Now we're going to reduce breathing exercises. We've already done the cadence breathing, the 4 in and 6 out. That's not Buteyko. This is now Buteyko. So you're not trying to deprive yourself of oxygen. This is not the point. Instead, you're trying to normalize your breathing volume. Air shortage during reduced breathing is not due to a decrease in oxygen, but it's due to an accumulation of CO2. So you're gonna, now this one, there's different ways to do it. Put your hand on your chest, your hand on your tummy again. You're gonna follow your breath. Just close your eyes if you want. Follow your breath. Become aware of your breathing. Concentrate on your breathing. Slow it down. You want to feel the air coming into your nostrils. Feel the air going back to the back of your throat. Feel your tummy move in and out. Maybe feel your chest move a little bit up and down. Try to keep your chest still this time. Gently breathe in. Get the air really deep down low. And gently breathe out. Now gently breathe in again. You're going to pause at the top and gently breathe out. And pause at the bottom. And gently breathe in. Get a sense of complete relaxation at the top of the inhale and gently breathe out. Now I want you to take a little smaller breath in, 30% less than what you're doing. Gently breathe in. Pause at the top and gently breathe out. Pause at the bottom and gently breathe in. Pause at the top and gently breathe out. Pause at the bottom. You're supposed to create an air shortage that's tolerable, not stressful. So if you start feeling like jerky, like there's spasming going on, it's too much of an air shortage. In this case, you'd want to stop for 15 seconds and then return to it. Breathing should be allowed to relax and reduce naturally. This is someone that is breathing erratically. This is a loss of control because they had too much of a reduced volume, too much for them to handle. So let me keep going here. You might see these signs when you're doing this exercise where there's sudden calmness or there's a feel of panic, one or the other. Your eyes might get glossy. You might get more saliva in your mouth. Your nose might run. Your hands might get warm and your face might get pink. Now we talked about the tape. I definitely think this tape is really important, but don't do it without a nasal dilator. Please, please, please. If you snore, please do. The most important thing is doing a nasal dilator if you're snoring. We got to shut our mouths, but you've got to use one of them. And I recommend you try them all. Buy them all and see which ones you like better. The Somnifix is actually one that has a little slit in it. That little slit in the mouth, it's a lot of people, and for women that don't like stretching their skin out, this is like silicone based, so it's really nice for the skin. And this one, you know what? Oh, shoot. I'm going to stop for a second. There's a new one called Myotape. Now, Myotape has a hole in the middle. And if you go to myotape.com, I gave that link to Christina. So all of these are in the supply list. This is for children too, smaller size. So my kids actually like the regular tape better, but you just stretch it 30%, put it on your face, and then you let go, but you got to make sure the corners are in. And then you see how it just brings your lips together? But people that are scared that they're going to suffocate or whatever, it keeps your mouth shut. So it's brilliant. My mentor from Ireland, Patrick McNone, who actually wrote this book. This is the book that you should get to help support you on this journey of breathing. And if you're an athlete, he wrote this book, The Oxygen Advantage. So really, I think, get this. This one was on the list. I think it's really important. And the last thing I want you to know is put your finger under your nose. This is one really easy way to kind of see if you're breathing too much. So if you, and you know, when I was riding public transportation to go downtown, I would do this on the bus or on the train. Now we don't use public transportation, but people don't know what you're doing. So inhale through your nose, exhale hard once. Do you feel that volume? Do you feel that air? That air, we don't want to feel that. So you're going to gently breathe in again. Exhale so light, so gentle, you almost can't feel it on your finger. Pause at the bottom. Gently breathe in again. Exhale so light, so gentle, you can't feel it on your finger. Breathe in again. Pause. Exhale gently, so light that if there was a feather here, it wouldn't fly away. Now, this is not what you're going to be doing all day. This is not. This is to reduce your breathing. This is to practice. You can't expect to just slowly reduce your breathing all day without focusing on it. And you got to focus on it 3 times a day. 3 little 5-minute times. Start with that. And walking in the middle of your day with your mouth shut might be a reduced breathing exercise for you, but slowing down for 5 minutes and timing yourself, doing in for 4, out for 6, diaphragm in for 4, out for 6, nose, finger under the nose in, you know, that one where you're slowing down and feeling the volume. This is all the volume on your finger. Now try it one more time with cupping. Cupping. Cup your face. So no air sneaks through. Gently breathe in. Exhale hard once. Feel that air. Feel that volume. Now gently breathe in. We're trying to reduce volume, remember. Pause at the top. Exhale so light, so gentle with your tongue in the roof of your mouth that you almost can't feel it on your hands. Soft. Try tolerating that for 5 minutes. And then practice nose breathing after that. You know, the whole idea is to change the way you're breathing, but we got to make sure it's through the nose. That's the most important thing. So 3 different times a day, I want you doing this. 3. And if you exercise, one of them can be just exercising with your mouth shut or take a walk with your mouth shut. In the morning, I want you to try to do the CP, the controlled pause. Breathe in and out, plug, and see when that first initial sign to breathe is. Neck jerk, tummy jerk. Okay? Then before bed, check yourself. Do your nasal line. Do this one with the sea salt. And that one basically it doesn't matter what you use, but I like this one because it gets back because you're swallowing it. You're swallowing it. You can also hawk it out and spit it out. It's kind of gross, but you can do that. But you want to get all that gunk out of the back of the nose. You can use that. Then you want to use your nasal dilator, whichever one, get them all, try them all, tape, and sleep on your side. Okay. So that is all for today. Sorry, I went a little bit over. Just know that we still have a little more Buteyko left, and we'll go over myofunctional therapy next time. And I'm sending you notes on how, what we covered. And you can also email me. I'll include my email. And at the end of all of this, there is a breathing clinic online program that I have that is awesome, that all you have to do is play the videos to remind yourself of how to do it. And it's really something that it's taken me a long time to do, but it's something that I've really wanted to do so people can do it anywhere. But it's a good review of what you're going to learn. So is there any questions that really need to be answered right now? And listen, if you want, I'm going to unmute you. So does anyone have any questions?
I think this was fantastic. Thank you so much. Oh,
good. I'm glad. It's, what, it's important stuff, and it's sometimes very much overlooked. But my dental colleagues, I think you all are more open to all of this. I try to talk to my ENT colleagues about it, and I think with this book Breath, it's going to help. But yeah, function really structures our body as we grow. But I'm so glad that this is an opportunity for you all to learn a little bit about how to properly breathe through your nose. Okay, if there's no questions, please know that you can always email me. I'll see you next week, same time, 4 o'clock. Thank you so much.
Thank you.
You're welcome.